Hello and welcome to another medical assisting review video. My name is Alex Flood. I'm a radiographer as well as a healthcare educator. I teach a medical assisting program as well as a limited permit x-ray technician program in the state of California. Um, I make these review videos to help my students, and I've gotten a couple of requests for a couple of different topics, and so I figured I'd try to cover some of these topics in just a few videos. One of those topics was a question about anemia. So I got a short little slide series to talk about anemia, and hopefully you'll come out with a better understanding of what we mean when we say that. First off, anemia is a disease of the red blood cells, a disease of our erythrocytes. Anemia is just defined as a deficiency in either erythrocytes or hemoglobin. You may have heard of hemoglobin as a measurement, a test that we can perform, but we can measure hemoglobin levels. Hemoglobin is the molecule in the red blood cells that is able to carry oxygen. Roughly speaking, you have about 250 million hemoglobin molecules in every red cell of your body. Those hemoglobin molecules are the ones that are able to hang on to oxygen temporarily, forming iron oxide, so we can carry oxygen around our body. There's 5 different types to talk about: aplastic anemia, hemolytic anemia, pernicious anemia, sickle cell anemia, and then lastly thalassemia. Let's jump in and talk about these. So some basic definitions for these. Aplastic anemia. Aplastic, we're using that word to mean without growth. So this one's a failure of blood cell production due to aplasia or the absence of cell formation in bone marrow cells. So this is just a decrease in overall erythrocyte count, red blood cell count, because of a failure to produce red blood cells. Secondly, hemolytic anemia. Hemolytic anemia is a process of a reduction in red blood cells because of excessive destruction. So if red cells are being destroyed faster than they're being replaced, hemolytic anemia can be a cause. And this is not a decrease in hemoglobin. This is a destruction of red cells. Pernicious anemia, which is probably one of the more common ones. It's a lack of mature erythrocytes caused by the inability to absorb B12 into the bloodstream. This is a common one in vegetarian and especially vegan diets, where they don't get enough B12 into their system because they're not eating any animal products. So often these patients will have to take a vitamin B12 supplement. Sickle cell anemia is a disease, an anemic disease associated with African Americans, and it's a hereditary disorder of abnormal hemoglobin producing sickle-shaped erythrocytes, and along with excessive hemolysis, breakdown of blood. This is supposed to be an adaptive trait to protect from malaria, and it's passed down hereditarily. Thalassemia is another inherited defect. This is a defect in the ability to produce hemoglobin, resulting in hypochromia. Hypochromia means decreased color. Let's take a look at some of these, how these look. So top left, let's start with the middle. In the middle, you'll see what a normal red cell should look like. It has a biconcave shape. It's kind of like a donut without the hole in the middle, and this double concave shape really gives it a lot of surface area, a big surface area to interact with the environment and exchange oxygen. Starting at the top left, conditions. An example of a condition that's not a decrease in hemoglobin or a decrease in erythrocytes, but it's a condition that affects the red cells. This is a hereditary condition called hereditary spherocytosis. What that really breaks down to mean is that the red cells, instead of having a biconcave shape, take on more of a circular shape, less biconcave. They are more fragile and with a decreased surface area. Moving over in a clockwise fashion to the top right, pernicious anemia, resulting in large, immature red cells called megaloblasts, and this is the condition associated with not pulling in enough B12 from our diet. Continuing in the clockwise fashion to the bottom right, sickle cell anemia results in crescent-shaped, hemolyzed, or morphologically affected cells that are distorted in shape and fragile. This affects things like their surface area for sure, and in any case, it's a hereditary condition. Bottom left now, thalassemia. Thalassemia is just a low hemoglobin concentration. And this is the one that results in hypochromia. You'll notice just by color, comparing to the cells in the middle, the normal cells, these are less red, more pinkish. Other diseases to be familiar with, at least by name, hemochromatosis is excess iron deposits in the body. Polycythemia vera is a general increase in red blood cells. Thank you for watching my small review video on anemia. Please check back next time for more.